After studying this module, you will be able to know what dental anomalies are, what are the different kind of anomalies, and the various forensic significance of those anomalies. To introduce you the topic, the study of teeth, let's take the teeth. The study of teeth and the factors that affect their formation is known as odontology. Forensic odontologist is therefore a person who specializes in the study of teeth and helps in solving legal problems, chiefly in the context of identification through his specialized knowledge. The forensic importance of teeth lies in containing a great deal of personal information coupled with being the most indestructible part of the body. Adults normally have 32 number of teeth. On each side of the mouth there are 4 incisors, 2 canines and 2 premolars and 3 molars, that is on all 4 quadrants. Each tooth has a characteristic morphology and consists of 3 regions. The portion above the gum line is called the crown. At the gum line is a constricted region called the neck, whilst the portion embedded beneath this within a socket in the jaw is called the root. Tooth owe their indestructibility through being composed largely of dentine. This is a highly calcified connective tissue that is responsible for giving the teeth their shape and rigidity. The calcium salts make up approximately 70% of the dry weight of dentine, thereby making it harder than bone. Since teeth have different spacing, orientations, distinctive gaps and weights, dentition offers an ideal method of identification. Given the fact that each person will develop or acquire unique wear and tear patterns and dental work such as fillings over their lifetime, the overall pattern is generally considered to be unique to each person. Dental identification tasks can fall into one of the 2 categories: identification by comparison and identification when no comparison is available. The forensic odontologists work with dentition and rely principally on comparisons of antemortem dental records with postmortem data. Along with dental anomalies, there are various other abnormalities which can be of importance in human identification. These abnormalities are abnormality of chromosome, which give rise to various syndromes such as Klinefelter and Turner syndromes and many more. These syndromes can help distinguish or establish uniqueness. Further, in this particular chapter, we will be focusing on dental anomalies and how they are helpful in the establishment of human identity, hence proving of forensic significance. To define dental anomalies, it is defined as the abnormality of form, function or position of teeth and the associated structure. It is basically divided into 2 classes: congenital or acquired. The congenital can be due to hereditary or due to maternal diseases, whereas acquired can be due to infection, malnutrition or hormonal imbalance. Schaefer, Hine and Levy, in the textbook of oral pathology, they stated that human dentition is never same in any 2 individuals and thus forms the basis for dental identification. To it added Kieser-Nielsen in dental identification, the chapter Certainty versus Probability Forensic Science, a much cited work. The uniqueness of teeth has been accessed mathematically. The potential for every individual to have 32 teeth, with each tooth having 5 surfaces which may be sound, decayed, missing or filled, gives every individual a unique dental identity. Differences in form, color, location, age changes, wear and tear patterns and restorative work are few reasons which makes the dentition as unique as fingerprints. However, these variations need to be analyzed by the dental examiners or the forensic odontologist, and almost all the time require the availability of antemortem records of an individual for the comparison purposes. Unfortunately, obtaining antemortem information may not be possible in all the cases, and especially in the country like ours where there is no maintenance of antemortem dental data. In these cases, the forensic team needs to rely on alternative sources of reference such as photographs and videotapes for identification of personal features at the time of postmortem examination. The dental anomalies therefore became a very important tool for identification, as positive identification can be achieved with confirmation by diagnosis of an anomaly by using techniques as simple as skull photo superimposition, photographs and videotapes. On the other hand, a small number of authors discuss the value of dental anomalies that are commonly missed by medical examiners. These variations analyzed by dental examiners can potentially lead to a positive identification. Then let us see the types of dental anomalies. There are various anomalies that helps establish identity of deceased. Developmental dental anomalies are thought to be marked abnormalities from the normal color or contour, dimensions, number and degree of development of the teeth. It is made of consideration that local as well as a few systemic reasons might be held responsible for these developmental disturbances. Such influences are not predefined and may begin right before the birth of a child or after birth and affect deciduous or temporary and permanent teeth. Irregularities in the standard number of teeth occur in supernumerary teeth, that is hyperdontia, that is excess teeth, or the term hypodontia where teeth is absent from the normal complement. Oligodontia is known as a developmental absence of 6 or more than 6 teeth including the third molars. Anomalies of shape is a kind of anomaly of teeth which includes two types, microdontia and macrodontia. Microdontia is a term which refers to a condition in which teeth that are substantially smaller in size than usual, whereas macrodontia refers to a condition where the teeth are physically larger in size than that of normal. Anomalies of shape includes conditions such as dens invaginatus, talon cusps, dens evaginatus, gemination, fusion, root dilacerations, taurodontism and concrescence. Now, dental invaginations or DI is thought to be an anomaly which results from invagination in the exterior of a tooth crown or very rarely the root end line by the enamel and dentine. Dens evaginatus is the focal area of the crown of the tooth projecting outwards in such a manner that it is thought to be giving rise to a horn-like protuberance on the affected surface that somehow seems to or appears as an extra cusp. Talon cusp is an accessory cusp usually located on the lingual surface and rely on the facial surface of permanent or deciduous incisors. It arises from the cingulum area or cemento-enamel junction of the maxillary or mandibular anterior teeth in both temporary as well as permanent dentition. Fusion and gemination is usually referred to as double teeth, which appear as larger than normal sized teeth. Gemination is well defined as a sole enlarged tooth or merged, that is the double tooth. It is a condition in which the tooth count is standard while the anomalous tooth when counted as 1. Fusion is defined as a single enlarged tooth or joined, the double tooth, in which the teeth count reveals a missing tooth when the anomalous tooth is counted as 1. The taurodontism is a condition of developmental anomaly of molar teeth. It is the state in which the body of the affected teeth is observed to be very large and the connected roots are found to be shortened with bifurcation close to the apex. Concrescence is the state where union of two adjacent teeth is by cementum. Dilaceration is a condition where an abnormal bend in the root or crown of tooth is observed. The bend is more frequent in the root but may be present anywhere along the length of the tooth. Then cleft lip and cleft palate. The most common craniofacial deformity is clefting of the lip and palate. Clefting, that is the incomplete fusion of the lip and or palate, can appear alone or as part of a hereditary syndrome. Family history of clefting increases the chances of inheriting the disorder. Cleft lip with or without a cleft palate occurs most frequently among Asians. Seen more often in boys than girls, cleft lip or hare lip usually appears on one side, most often on the left side. A bilateral or two-sided cleft is less common. An incomplete cleft stops short of the nostril. A complete cleft goes into the nostril. Both cleft types often involve the palate. A typical patient with cleft palate or cleft ridge has defects in the roof of the palate with an opening into the nasal cavity. Now let us see the forensic significance of these. The role of dental anomalies, particularly those affecting the shape and size of anterior teeth, can never be overemphasized in the positive identification of an individual, especially one needs to rely on a smiling antemortem photograph. Anomalies like mesiodens, peg-shaped laterals and macrodonts and enamel hypoplasia are common in various populations and help to establish the uniqueness of a person. The knowledge of dental anomalies may also play an important role in identification when the victims are children. This is for the simple reason that most of them are a part of deciduous dentition. Secondly, corrective, restorative, orthodontic or prosthetic measures are taken after the child attains a certain age, closer to an adult, when there is a considerable increase in the level of consciousness and aesthetic concerns of the individual. It is often noted that the children are not regular with the visits to the dental clinics due to psychological barriers or lack of motivation and understanding. This contributes to the lack of availability of the antemortem dental records, more in case of children as victims than adults. The knowledge of dental anomalies therefore goes a step further in identifying child victims in absence of records. Briefly speaking, there are two types of identification problems that may be encountered in forensic odontology, namely one of criminal nature such as bite marks on the victims of sexual offense or bite marks on food items in burglary offense, and the other type of non-criminal nature. The non-criminal nature of identification may include the following types like mass disaster victims like aircraft, train, bus and boat accidents, explosion and fire in buildings and floods. Then identification of bodies where death is not due to suspicious circumstances. And third condition, where identification of remains of the victims of wild animal attacks. The problems of criminal nature may involve identification of a living person, identification of dead persons, comparison of bite marks left at the scene of crime, identification of bite marks on the assailant, identification of bite marks left by the assailant on the victim, and the identification of bite marks left by the victim on assailant. To summarize this topic, the human dentition is never same in any two individuals. This forms the basis for dental identification. The uniqueness of teeth has been assessed mathematically. The potential for every individual to have 32 teeth, with each tooth having 5 surfaces which may be sound, decayed, missing or filled, gives every individual a unique dental identity. Variations in shape, color, position, age changes, wear and tear patterns and restorative work make the dentition as individual as fingerprints. Dental anomalies are developmental disturbances or variations from normal that help to establish the uniqueness of an individual apart from the differences in the morphology and arrangement of the teeth from person to person. Hence, they are important tools for identification, particularly in the absence of dental records. Further, when we talk about the other congenital anomalies like cleft lip and cleft palate, they also help in the identification of an individual. So, they also have got a huge forensic significance, which has been already covered in the other module.